Welcome to this webinar, Reaching Access Targets with Effective Digital Provisions, brought to you by SBK Healthcare and kindly sponsored by Limbic. To find out more about our online forums, workshops and webinars, please do visit our website iapt-nnf.co.uk. Hear practical experiences of Limbic in action with Andy Wright, the Chief Operating Officer, and Mona Stylianou, she is the Principal Clinical Lead at Insight IAPT, and find out how digital innovations can help you enhance your access rate and reach your targets.
So, morning everyone. I am Ross Harper and I'm the CEO and the co-founder of Limbic. A little bit about Limbic. We're a team of clinical psychologists, AI scientists, and software developers. And we're really on a mission to bring the latest AI technologies safely and responsibly to NHS IAPT. And I think that's a big part of our DNA as an organization. We're UK based and we built specifically for IAPT. This is a unique care system and we strongly believe it deserves its own solutions. So I think the plan today is that I bend your ears for about 5 minutes. I introduce our product. I sort of talk through how it works in IAPT more generally, and then you actually get to hear some interesting stuff from Andy Wright and Mona Stylianou, who join us from Insight IAPT. Andy and Mona, I wonder if you could quickly turn on your video and just do a quick wave. You'll be hearing from Andy and Mona in a moment, and I promise I won't take too long. So let me see if I can go to my next slide. We started Limbic, as I said, here in the UK, and what we wanted to do was we wanted to solve a big problem faced by IAPT, and that problem is the national shortage of trained mental health professionals. I know this is a problem that's felt acutely by people on this webinar. It has a number of downstream effects. So the workforce supply problem that we are experiencing currently can negatively impact patient wait times. They can be longer. This then in turn can impact attrition and lead to high drop-off. Naturally, that affects service user satisfaction. A reliance on temporary staff and agencies can increase costs. And something that isn't always spoken about, is really important, is that the well-being of staff within IAPT can be negatively impacted due to overburdening. So we really wanted to try and help this issue. Our response to the problem was that we created Limbic Access. It's a triage and assessment support chatbot. And as I said, we built it uniquely for IAPT. So as you can see on the right here, services add Limbic Access to their website or a number of websites actually. And it's this friendly AI assistant. It pops up and it assists the patient in making a referral. You'll also see on the left here that we really invested heavily in making sure we're safe and secure. So just to pull out a couple, we're a UKCA marked medical device, which means we conform to the highest clinical standards. We've been accepted onto the G-Cloud 13 framework, which we're really proud of. It means that IAPT can procure with confidence. And finally, if I just draw attention to this middle one, we're actually the highest rated regulated mental health app in the ORCA library and the only e-triage solution for mental health to have been through ORCA's rigorous evaluation process. So we're really, really pleased about that. And I think the reason this is important in our minds is that best-in-class digital solutions need to be done right. They need to be safe. They need to be responsible. And we need to be accountable to these sorts of things from a clinical and data governance perspective. So I'm pleased to say that we're currently being used across the UK by around 25% of IAPT services. The reception and welcome we've received from the IAPT community in general has just been really humbling. So quick note to say how grateful we are to all of you for that. And then finally, a big part of how we developed this tool was we wanted to make sure that it was improving efficiencies and supporting services. So we made sure that interoperability was at the heart of what we did. And indeed, we're integrated with all the usual systems used by IAPT. And we're an approved partner of NHS Spine, so we can do some clever stuff in the background. So what's the point of triage and assessment support? So the idea is to streamline things. Hopefully what you're seeing on screen at the moment is somewhat reflects the pathway into your service. It's sort of a generalized representation. Typically, what we see is a patient visits a website, they submit a self-referral through, for example, a web form. Then there's a wait while the admin staff on the service end check that this individual is indeed suitable for the service. For example, is their GP in the catchment area? Are they the right age group? Then there's the admin staff member will call out, hopefully get through. There'll be some additional data collection, and they'll try and book in an assessment, and then there'll be a subsequent wait while the patient waits for the therapist to be available for the therapist-led assessment, and then treatment can begin. So what we wanted to do with Limbic was we wanted to see if we could streamline this journey into care through a digital solution. So what we do is we take care of the admin stuff. Limbic pops up on the service website, and due to our integrations, we're able to check whether they're in the right area. We can find out if they're the right age group. We can apply these criteria for suitability. And if they're in the wrong place, we can actually look up where might be a better place for them and signpost so that the patient doesn't have to wait. If they are suitable for the service, we can then manage a referral in, we can assist in answering the questions, and really importantly, we can then conduct a validated mental health screen, which means that the subsequent therapist-led assessment can really focus on key issues and on building that relationship with the patient, and it can be highly efficient as well. So that was the fundamental goal of what we were trying to do. I can share some high-level results with you. From a national perspective, we'll hear more from Andy and Mona in a minute on a service level. So in 2022, we've helped over 100,000 patients access IAPT services. As a result of the screening we're performing up front, we've been able to release around 30,000 clinical hours for IAPT, which is huge and really the point of why we were doing this in the first place. And subsequent analysis has revealed that Limbic Access, when compared to the more traditional web form, helped an additional 10,000 patients enter care during this period, which we're really pleased about. So we've had good feedback from PWPs. Just pulling out one example here, it means once we've done the screen up front that the PWP during the assessment can focus on how to best support the client without worrying too much about missed information. And it's a richer discussion with the patient around goals and next steps rather than feeling rushed. What I'm very excited to share on this call is that we have some really cool evidence that shows that Limbic Access is associated not only with increased access, but also increased recovery rates and reduced wait times, which was the whole point. Really, we wanted to support IAPT hit these national targets, and I'm really pleased. So I think I just take this opportunity to note that we'll be publishing these results next year. And if you'd like to be kept in the loop or get a first glance, then just feel free to email me directly. My email was on the first slide. It's ross@limbic.ai. Very happy to take you through some of the results. So that's enough from me. We've been working very hard with Insight IAPT over the last year, and we've figured out with them how to maximize the impact of Limbic Access within the IAPT model. So I'm really grateful to Insight for all their collaborative approach and their innovation. And we now are lucky enough to have two people from Insight. That's Andy Wright, who's the Chief Operating Officer, and Mona Stylianou, who is the Principal Clinical Lead. They're going to share their learnings with you all, and hopefully will help if you're thinking about this sort of digital transformation within your service. So I'll be quiet and I'll leave it there.
Thank you, Ross. And thank you for the introduction. And hello, everybody. My name is Andy Wright. I am the Chief Operating Officer for Insight IAPT, and I'm joined by Mona, who will introduce herself in a minute. Just a little bit about me. I'm COO for Mental Health Concern. We're a charity principally based in the northeast of England, and we do lots of community-based mental health, provide lots of community-based mental health services across the region. And we're also have a sister organisation called Insight IAPT, which currently runs 7 IAPT services across the country, from as far down as the southeast in Kent and Medway, as far west as the Wirral, and in and around the Midlands area as well. I have been with Insight and Mental Health Concern for just over a year. And prior to that, I spent 12 years working in the NHS, delivering IAPT services myself. So that's a little bit about me before I go on to talk about the presentation, I'll just hand over to Mona to say hello to.
Hi everyone, thank you for having us deliver this talk today. I'm very excited to be here. My name is Mona Stylianou. I'm the Principal Clinical Lead for Insight IAPT. So I work across all of our services across England. I was going to say UK, but we're only in England. Overseeing the sort of clinical delivery of our services. I work very closely with Andy. And we've been working with Limbic for I suppose a pre-implementation to probably about 1.5 years now. So we've got a really good relationship and we're really keen to share our learnings and our journey with you today. So I'm going to hand over to Andy. I'm managing the slide, so let me know when you need me to move the slide forward.
Thank you. So thank you to everybody who took the time to register and come on the call. And one of the things that you were asked to do was just sort of comment on what it was that you wanted to get out of the session. And we've had a look at, we had over 100 responses to that. And that forms just some comments from our next slide. Mona, if you can move that on for me, thank you. So we'd sort of, you were asked, are you able to
Can you see it? No, it's not working now. Hang on, let me try again.
We'll keep going.
This was going so well in rehearsals.
It was going brilliantly. So you were asked
there we go.
What it was that you wanted to get from today. And Mona and I took that sort of question very seriously and your responses, and took the liberty to sort of clump together the themes that came out of the over 100 responses. And they were really around a group of people. What came over really strongly was a group of people who were looking for new ideas on how to actually work digitally in this digital space. And I guess the opportunities to learn from the experiences of others, they're not that readily available, and that might be something for us to think about. But taking the opportunity to share our experience, learn from that, share any tips and advice on how to innovate in this space, because there's an awful lot of discussion about digital innovation. When it comes down to actually the doing part of that, I think sometimes it's a little bit more challenging. And we're really proud of the journey that we've been on, and we're more than happy to share, our experiences with you in the hope that that's actually helpful for you and your own journey. And as part of that journey then is gaining a better understanding of the potential pros and cons. And I think coming with a considered view, a rounded view, an ability to appreciate both the benefits and the things that need to be taken care of is a really important part of that journey. And another important part, I guess, is around the your interest in what kind of savings can be enjoyed if you embrace this kind of way of working. And I really liked the comment that a couple of people put about the question about whether or not you should even do it in the first place. And I really welcomed that level of sort of inquisitiveness, transparency, honesty, and maybe sometimes there's a little bit of ambivalence as well about, is it worth it? Should we actually do it? What might that look like for your organization? And just a little bit from me, it was really interesting. I mentioned to you, I've been with this organization for just over 1 year now, but I actually met Ross and the Limbic team probably about 4 years ago. And he very kindly shoehorned himself out of the Southeast and came all the way up to North Yorkshire to talk about Limbic and what it might be able to do in IAPT. And really at that time, it was a really sort of impressive and very challenging conversation, because it was nothing that I'd ever experienced before in the context of all my years working in IAPT. Sadly, it never really got off, out of first gear and off the launch pad really. And I think for me, what the learning was about thinking about who else, if you want to embrace this way of working, you kind of need to be able to think about who else needs to be involved in order for you to land any particular innovative digital ideas? Because I guess on this call we've got people who are already interested in expressing an interest in it, but it's quite important, I think, to think about who else needs to be involved. And if you were going to land something like this, what would you need to do? So what can we offer you today? We've talked about what you wanted. What we're aiming to do is give you an honest account of our journey implementing Limbic AI within our IAPT services. And so that does mean talking about maybe some of the challenges that we've had to overcome, as well as some of the benefits. We absolutely want to share our lessons learned with you. We are really open to that, and we're happy to sort of expose some of the kind of inner workings and learnings that we've been through. For a lot of you, you wanted to understand the key outcomes, including the impacts and efficiencies. So we're going to share some of those with you, and I hope you find those interesting. And we'll talk a little bit about what's next on the horizon for us. What are we going to be doing next? And finally, if there are a group of like-minded people on this call, I guess Mona and I talked about wanting to offer you some encouragement in whatever way and direction you want to take your digital journey. We're part of that community. We're part of the IAPT community, and we want to support and offer you a level of encouragement. And I hope that comes across in our presentation. And I hope you find that useful and enjoyable. I mentioned my time with Mental Health Concern and Insight IAPT. I wasn't actually here when the beginnings of the story about our relationship with Limbic started, and I'm so grateful to Mona for joining me today, because she's going to take you through a few slides just talking about starting off with the journey that we've been on. And it will come as no surprise that when you implement something, actually the implementation is one part of that, but there's a huge amount of preparation, discussion and conversation that goes on. So I'm going to hand over to Mona, who's going to take you through the next few slides to just share a little bit more of that journey that we've been on as an organization.
Right, and try and move the slide forward. Sometimes it works, sometimes it doesn't. Oh dear, bear with me. Okay, from here. Is that moving? No, still not. Okay, I'm not going to panic. I'm just going to calmly try again.
There you go. Oh,
yeah. There we go. Okay, so I suppose for us, this journey began, like lots of changes in IAPT services, through the pandemic, thinking about changes in how we were delivering IAPT services pre-pandemic versus post-pandemic, and that recognition that actually we could do things differently, and we had been doing things differently throughout 2020 with offering remote therapies and not being present in hubs and venues, and as a result of that, I think there was an appetite to look at how can we work smarter, how can we do things differently. But to support us particularly with that journey is our organization is very innovative and very dynamic, and we do have a strategy that is has a high desire for innovation and delivering operationally and clinically excellent services. So I think for us that was a key. We are working in an organization where there is a desire for new tools, implementation of new ideas, and obviously we were at a point with the rest of the UK where we were looking at how we do IAPT services, how do we get the best value, and how do we support staff who are potentially also feeling pretty burnt out, tired, and as Ross already mentioned at the beginning, this issue around staff retention and the attrition rates of particularly step 2 workers. So what that then led to is a conversation with Limbic to explore how we could improve not only patient experience, although that's a really big key issue for us in this and something that has really improved and has been a really big positive for us, but also that staff experience of coming to work, looking at caseloads, assessment caseloads, particularly the hours spent completing assessments. And so for us, Limbic AI felt like a really good product. It fits in with our values, and our relationship with Limbic is great in terms of how we work together. So to start with, and I think this is key to look at the sort of the journey, and Andy's going to talk to us about outcomes and results in a bit, is the how did we implement Limbic? So the first thing we created was a group of people from across the organization into an implementation group, and we started to look at what it is that we wanted Limbic Access to do for us, you know, the why, how, what questions that we look at in terms of how is this going to work for us, how is this going to look like us, how does this fit in with the sort of tone and language of how we do things in Insight. So we know we wanted Limbic Access to streamline our referral and access to treatment processes. So looking at what we had before, the sort of very standard web form on our website, and the what came from that, and the workloads for step 2 workers, but also for our admin workers in that completion of that data on the systems, but also then to support us to look at our pathways, and particularly that step 2 adherence in terms of the IAPT stepped care model, that access to treatment process, wanting to kind of get smarter and better at doing these 2 things better. We were aware of waiting time issues, so that was a desire from the beginning that we wanted waiting times to be reduced. We looked at how would this tool support us in terms of looking at risk, particularly risk at the front door, and what we were going to do with people who might potentially come through this process who were potentially high risk. And one of the big things for our organization, and one of our values, is that there is no wrong front door. So how do we support that whilst implementing a sorting hat of sorts, like what I call Limbic. When I describe it to people, I call it a sorting hat. But thinking about, you know, how can we support people who are potentially in the wrong place and in a crisis, and still be able to use an artificial access tool? The huge benefit from Limbic has been the patient information auto-generating into our patient records. So the amount of time being spent gathering that data has reduced considerably. The AI that collects all of this information at the front door, so it's been brilliant. And our big wish was around that potential staff burnout being reduced. So those were the kind of keys that we started with, looking at the beginning of the journey. What are we going to do? How are we going to do this? And create this group. And for that implementation group, we had quite a lot of people involved, clinical leads, team leads, operational leads, PWPs, admin staff, data people, development from our IT team. You know, it was a big cross section of our staff, and representing different parts of the business in terms of looking at making sure that we were covering all angles in terms of how we wanted this to look for us. Right, fingers crossed it's going to work now. So we wanted this to be very specific to our service, and that's one thing that Limbic has been great with. This is a very bespoke pathway for our service, and it may look different in different services, but for us, we spent a lot of time, particularly with the clinical staff, looking at, you know, what felt comfortable for us, how did we want this to work for our service. And one of the key things for us is actually we wanted it to be a kind of a very conversational tool, and it is anyway, but we looked at the language and made sure it fitted with us. We looked at kind of inclusion, exclusion criteria in terms of how we streamline people post that referral through Limbic. And what we wanted to create was a smoother, faster pathway, particularly for those patients who are step 2 suitable. And for us, this links to a kind of bigger digital pathway or digital strategy that we are working with in terms of looking at how can we offer step 2 suitable patients a quicker, faster route into treatment, those mild to moderate patients. And one of the big things for us is delivery of webinars. And we looked at how Limbic can potentially help people who have mild to moderate problems get into therapy pretty quickly. So what we did for our services had that very clear inclusion, exclusion criteria in terms of how we start sorting people into what we then created and called a shorter, focused limbic assessment versus a full step 1 assessment in the old IAPT model style. So that was a key requirement, that we identified who might be suitable for that shorter assessment. And what that then means is that we can get more of those step 2 suitable people through the doors quickly, into treatment quickly. And that allows our step 2 staff to really focus on those slightly more challenging cases or complex cases or more severe cases in those fuller assessments and into step 3 pathways. So we created this shorter focused assessment, and what's really great about Limbic is that we were able to create a diary at the end of the referral process where the patient at the end of their referral can self-book into the next available Limbic assessment. And that's been key in this sort of looking at this flow of how quickly people can come in through the front door. So they refer in, they can get into an assessment within the next 5 days, and they can potentially be in a webinar the following week. So really speeding up that process for those patients where that is suitable. And then we also identified that obviously we're going to get lots of people possibly in who may not be suitable for an IAPT service. So we have a high risk flow, which goes to a center we call our clinical referral team, which is something that we've created in Insight IAPT, which is a sort of a risk assessment team at the front door at the point of referral. And because we're a national organization, we've been able to do that on quite a large scale in terms of all the referrals coming in across the country. So obviously we've got the risk going to one place. We're also then able to identify those people who might need a soon as assessment in terms of potentially showing some level of risk. And then we've got the patients who are coming in, fitting into that step 2 suitable flow and going through fairly quickly. And one thing we did before we launched is we did a very comprehensive staff training program across all our services. We went to every single service. We delivered webinars on how to understand Limbic. Why are we doing this? What will be the benefits of this? You know, what sort of things we were going to look for in that process. We invited questions from our staff from every service. We got feedback. We got people to test the AI tool on the website. We made amendments as a result of that. So, you know, that I think that took probably about 4 or 5 months for us to really go through this process from beginning to end to identify what it is that we wanted, why did we want it, and then how we were going to implement that across. And as part of that training, we created templates and script for the focused assessment. And I'm going to talk a little bit about kind of the specifics about what happens in those focused assessments. So for those patients that we think are suitable for a step 2 pathway, based on the information that Limbic has gathered at the front door, we have created these shorter Limbic assessments, which means that for our step 2 practitioners, they know that they're going to have some assessments which are going to be shorter in time, but also much less severe. A lot of the data has been gathered in advance, so we can reduce the time needed to potentially check in with a patient, which just helps us flow things faster. And these are the patients that can self-book their assessments at the end of their referral process. We always have at every single referral from Limbic a clinical assessment, and it's always delivered by a PWP. So the person is always still present. No one goes through the pathway without speaking to a clinician. And what we decided, we needed the presenting problem suggested by Limbic to be a step 2 appropriate presenting problem. These patients should be kind of presenting with low risk or no risk, ideally. And and have mild to moderate PHQ and GAD as gathered by Limbic as part of the referral process. And then what this also allows us to do is it kind of just allows us to confirm that the information that's come through Limbic is right. So there may be things that have been missed. There may be things that the patient hasn't mentioned in the referral. So there's an opportunity to check in. This is the suggested pathway is you've got low, sort of mild to moderate low mood. Is that right? Do you agree with that? You know, is there anything else we need to know about? Any previous diagnoses, etc., etc. And we also then have that opportunity to step those patients up to step 3, more complex, sort of a further assessment for a step 3 suitability, where we feel like actually the pathway's gone wrong. But that doesn't happen very often. And Andy will talk about the stats in terms of numbers of how many people end up in that second assessment from our services. And then the idea is that from this pathway particularly, we are moving our patients into those step 2 focus pathways, so webinars, Silver Cloud, or guided self-help. And I think that's it from me for now. I'll hand you back over to Andy.
Thanks, Mona. I hope what you've sort of got a sense of there is that one of the questions you might be asking is, do we want to do this? And if so, what might that involve and how would we land it? And I hope that's just a kind of an introduction to some of the appreciations you need to have if you want to land it well. Oh, I'm in a room that's got an automatic light, so there you go. If you're going to land it well, what are some of the considerations that you need to think about? And they are pretty wide, and they can be quite complex, and it needs time and consideration. But you only need to do that once. So then the next thing you wanted us to think about was the impacts, and I'm going to spend a few minutes just taking you through some of the so what's. You know, so we've done all that work, we've done all that heavy lifting, we've done all the preparation and the implementation, and the first slide here is nothing more than a nice coloured visualization, just to show you as an organisation with our 7 services how much self-referral is an important element of the referrals that we receive. Diagram on the left and the green, and of the digital referrals that we receive, how significant Limbic has become, which is the purple element of that. And I'll show the actual stats on the next slide, but the orange wedge on the right hand side is the number of digital referrals that we receive via our web-based form, which is a kind of, I guess most IAPT services have a website. Most websites in IAPT have an opportunity to refer yourself, click here, and invite patients to sort of put their details in. So that's a very, for some services, a relatively new thing, but for many services, it's a standard way of practice. But it shows you, I guess, this pie chart, just how that's gone from being a really significant part of how people onboard to our organization to actually a very much a minority element of patients now that we've implemented Limbic. So let's move on to the next slide and have a look at some of those impacts then. So for some contextual bits from me, now having analysed the last 12 months worth of data since we went live with Limbic in November last year, 68% of our referrals come via a digital route now. And we've been on a journey with that. And of course, over the last 12 months, there's been variation and acceleration in some elements of this information. But overall, 68% come via a digital route. Limbic is responsible for 90% of those digital referrals. So as you can see, that's a really significant contribution. And that equates to 61% of all referrals. So Limbic has integrated itself really well into our pathways. It's the vast majority of our digital referrals, and it's a significant proportion of our overall referrals. And like I mentioned about the traditional web-based form, that now only represents 10% of our digital referrals, which might be something, be interesting, I guess, for you to compare for those people on the call who are in IAPT services to think about that. One of the things about using Limbic on our website, which pops up, and Ross just gave you a little sort of teaser of what that looks like, I guess, is that when people start to engage with Limbic on our website, which is where it sits, the actual completion rate of people filling out a completed referral on themselves is above 90%, which we're really pleased about. And it takes on average about 9 minutes to complete. So some of what's being collected, which migrates into the patient record, is stuff that traditionally we might have done inside the assessment. So you can start to see where some of the savings and some of the benefits start to arise. What's been really interesting for us is that 35% of Limbic referrals are made when we're actually closed. So our core hours and our fantastic administrators, our patient coordinators, are not here all the time, but our website, which has Limbic on it, is. And I think it's been quite a revelation to us, just about how many people actually refer themselves outside of our core working hours, and that the completion rate of those referrals is so high. So that bit about reaching out to people, being there at the convenience of the patient, not ourselves, that's been a bit of a humbling journey for us to think about how people are accessing us, and it's given us a new insight into our services. You may be interested that 17% of the Limbic referrals are identified as moderate risk, and a small proportion are identified as high risk. But Mona, as our principal clinical lead, spent a lot of time thinking about, we should anticipate and expect those people. So what are we going to do to make sure that this process, this pathway is safe? And that does need serious consideration. And I've just put our overall BAME referral rates at 12% and LGBTQ plus referrals at 15%. On face value, we're really pleased with that. But of course, you'll know that that needs to be contextualized in the context of our quite diverse services and where they sit and the populations that they are there to serve. So for us, that's something that we really want to start to drill down into. We know the IAPT program has really clear expectations about the volume and the outcomes and experiences of people from those groups. And we're really proud of what we're doing. And this is part of a wider piece of work for us that we're looking at, which I'm sure you are doing in your services too. So the next slide is going to look at some of the other impacts. So what we found, we just tried to put this in some kind of a relatively crude but impactful chart. When we went live with Limbic, the overall referrals into our service went up 32%, right across all of our 7 services. And one of the bits of learning that Mona will probably touch on a bit is that happened pretty much overnight. And what we saw was, which was really pleasing, was a corresponding increase in the actual access of people coming into assessment and treatment sessions in our service. My experience of working in IAPT before would have been, if we wanted to seriously increase access, we would have to go out and do a huge amount of sort of promotional work and anticipate quite a significant drop-off rate of all that work from referrals to access. What we actually saw almost immediately was a significant, increase in the number of people who were going to our website and completing an actual referral into our service. So there is something about the experience of jumping on our website that then had an AI on it that you were able to interact with, which really seems to have incentivized people to engage. And I think that's probably one of the most fantastic realizations for us. I'm not going to lie, a 32% increase in referrals and access almost immediately, caught us a little bit by surprise and off guard, and that's one of our bits of learning. But nonetheless, that's exactly what we wanted to see happen, and it did. It just happened, if I'm honest, a little bit quicker and a little bit more effectively than we had anticipated. But interestingly for us, both elements were immediate, and over time what we've been doing is tracking that, and they've been maintained. So 57% of limbic assessments also directly booked by patients at the time of referral. So if you think about how reliant we've become on limbic to pathway people into our organization, and at the same time people are booking themselves into the actual assessment, you can start to see and realize where some of those benefits are starting to happen. And the assessments that we've done were delivered 40% quicker than the average compared to our control group, which is other people who onboard in our organization. So again, just really impactful for us. We've had a different appreciation and approach to hitting and increasing access. And there is something about how people interact with the AI that genuinely seems to have prompted and encouraged a different type of behavior from people looking at our website and interacting with it. We've also had the benefit of some early observations from Limbic themselves. This isn't quite the full year for us, but we just wanted to include them because there's a different offering and appreciation here. What we've seen, Mona's talked about a limbic assessment that can occur for people with mild to moderate scores and no risk. And what we've noticed in delivering those assessments, the limbic assessments are nearly 25%, or we've seen a 25% reduction in assessment time for limbic assessments. So the assessments we deliver are shorter. We can get through it quicker. We can make assumptions about who comes to a limbic assessment. And we've also got information already in the patient record. So there's been a 25% reduction in assessment time for limbic compared to other assessments. It's been a 13% reduction in wait time for those assessments. And that might be about how quickly people are able to book themselves in, finding a place and a time that's convenient to the service user or patient rather than what we're able to offer them. And we've seen a corresponding 5% shorter waiting time for people going into treatment. And that might be about how quickly they're transitioning through the pathway and how quickly they're moving into the waiting for treatment element. Interestingly, we've also seen 18% less likely to drop out from treatment, and 45% less changes in treatment allocation. So when people go into the pathway after a limbic assessment, they seem to move around less. And finally, what we're reporting is a 53% improved recovery rate. Now, if there is anybody on the IAPT, in an IAPT service on this call, that will probably pique your interest, and you'll probably be really interested in that, as are we. And we are working with our colleagues in Limbic to try and really unpack and understand and drill down into what might be happening here, because we know some of these concepts are complex and there are many things that contribute to them. But we're really delighted that the early observations are on the right side of what we would want to see happening. I think the challenge for us is to really get down into and understand why they are happening, so that we can maximize the benefits for our service users and patients.
2 minutes, Andy.
Yeah, thank you. And I'll just hand over to Mona for the last couple of slides. Thank you. You're on mute, Mona.
Going well. Just clarifying the 45% step across, it's across all our assessments. It's not just from limbic assessments, it's all of them, which is an even bigger percentage. But I just want to spend a little bit of time on lessons learned in terms of the things that we've learned on this journey, And the big one is, when you're implementing a digital tool, it needs to sit within that wider digital strategy. So for us, this was part of a bigger picture around how do we become more modern, smarter, faster, thinking about how we do things in a more digital way. And that learning around change management, that needs time, it needs effort, it needs a lot of resource, and it needs a lot of focus. And the key people to include in that is your admin teams. For us, that was really important that they were with us. They came with us on this journey, and we did it together. But it took time. It wasn't a quick process. We spent a lot of time. We were very careful around what we needed to do before we felt ready to go live with Limbic. Something I think is really important is in kind of understanding the kind of benefits of this is benchmark your performance prior to implementation, and then you can measure the impacts regularly. Your data analysts, your information analysts are really critical to any success in implementing a digital tool. And one thing we didn't predict at the beginning is immediate impact. So something really keep in mind. Be prepared for immediate impact. So we were calculating our assessments needed, either shorter or longer ones, based on the current referral criteria. The impact of the referral and access going up so quickly was that we had to then remodel diaries and look at how can we find this extra resource. So that was a really big learning for us. Expect the unexpected. I think, you can't predict everything. You can't sort of future-proof for every eventuality, and that's something to sort of feel a bit flexible around. One key thing, and I'm sure Ross will remember this, is one of the big things for me at the beginning was, if it all goes horribly wrong, can we turn it off? How long will it take to turn it off if we panic? Luckily we never had to do that, and we were prepared for most things, but having that option was helpful for me, kind of that reassurance on my shoulder. The one thing that we've really learned from this is that data that Limbic gathers is the same regardless of where it comes from in our pathways, in our services. And what we have learned through this process is having this tool on our website, this referral, this data being gathered by AI, really highlights clinician bias and variation across the country and across our services. So we may have 5 patients with the same scores, same presenting problems, going into 5 different assessments, and they come out with 5 different outcomes in terms of pathway adherence. So we've kind of from that implemented some, pathway planning and mapping and looking at where people should be going based on those stats. And that's where our information, our data analysts have been absolutely vital. And the training that we did at the beginning was vital, but there needs to be ongoing training, refreshment. If anything changes in the system, you need to go back and continue that training of your workforce to understand the tool and understand why we're doing this. And what we really learned is patients want this. The appetite from patients and from staff for kind of digital innovation is higher than we thought or realized. People are asked for it. They like it. They like these things. People really like referring in through Limbic. They don't have to speak to someone. They can get that first really difficult step completed quite safely, and it feels comfortable. And that's the feedback we get back all the time. I just wanted to touch a little bit on our future plans. So we are piloting something called Limbic Care. I'm not going to talk about it too much, but it is a kind of a practitioner or a therapist support tool for patients between therapy sessions. We are looking at bringing in some AI support in our webinar delivery, and we are looking at doing some research on all these impacts that we've been observing and looking at how we might integrate some of the Limbic tools into some of our other services within mental health concern that aren't IAPT. And I think that's it from me. Any questions?
I'd like to jump straight in with the questions. So follows really nicely, Mona, from your last message. Someone's asked and they've said, I'm just looking at your website and I've seen a product called Limbic Care as well. Is that used to treat patients once they've been triaged?
No, so it's not going to be a replacement for treatment. It is just a support tool for therapists and the patient during treatment.
Thank you. So I have coupled 2 questions together. It's asking of recovery. So how do you measure recovery? Do you have any ideas on what your improved recovery is due to? And then when you talk about improved recovery, is it due to mild or to moderate presentations?
I could let Insight share how they measure recovery, and I'm happy to speculate on the remaining part of the question.
Do you want to start then, Ross? Because I think it's about that percentage we talked about in terms of the increase in recovery rates since the implementation of Limbic.
Yeah. So, well, the way we would define recovery would be according to how IAPT define recovery. And I don't want to misspeak, so I will let Andy or Mona confirm that. But firstly, in the interest of scientific rigor, we don't want to start making causal claims as to how we've observed what we've observed, because you need to do an in-depth analysis to make those claims. I'm happy to speculate, and I think with the caveat that I've just made, ways that recovery could be improved by triage and assessment support are, firstly, we are observing a positive impact on patient engagement for those who come through limbic access versus those that do not. Now, it's known that engagement and activation within care is an indicator of clinical outcomes and is associated with improved clinical outcomes. So there would be an indirect link. Another mechanism that could be at play here is that through the service improvement and operational improvements that Andy and Mona spoke to, there are clinical hours that have been released that could be turned to treatment, so that a downstream effect of efficient triage and assessment support is that the clinical resource can be aimed at treatment, and you would then expect to see an improvement in recovery rates. However, we are going to look into this more rigorously.
If there's anybody on the call who's in an IAPT service, I'm sure you'll be well familiar with the calculation for recovery. But for those that aren't, it's a binary calculation that's used. It's calculated using psychometric measures, so PHQ-9, GAD-7, or an appropriate disorder-specific anxiety disorder-specific measure. So it's a calculation that identifies patients in caseness, so they've got symptoms and a level of symptoms, and then at the end of treatment we'd expect to see a drop in those self-reported scores below a threshold that allows you to say that the person's moved to recovery. So it's symptom reduction over time as a result of evidence-based treatment.
Thank you. Thanks. So there's actually a really interesting question. Did you co-produce this digital tool with service users? They were not mentioned when Mona said who was involved in the design and planning stages. Are service users regularly engaged with to understand what works and what doesn't?
Yeah, unfortunately for this project, we weren't able to use service users. It was just post-pandemic, and the way we set it up, unfortunately, that wasn't an option. We are looking at service user feedback on a continuous basis. The Limbic team are really good at delivering that feedback to us. We get a monthly report on all the feedback. We have now restarted our service user groups, and they're very much involved in future planning and our webinar development and the Limbic process in terms of the Limbic care that we are working on at the moment. So yes, it's something that missed in that moment, but we are getting a lot of feedback. So and I'd say it's, on the whole, very, very positive, in the 90s at all times.
Oh.
I can add to that just a little bit. Echo what Mona just said. It was a pandemic, and there were some considerations, but the initial design for Limbic Access was supported by an Innovate UK project, and as part of that, we assembled a panel of patients who were in treatment. And we interviewed them to get their feedback on what this tool needed to be and how it needed to be delivered. So during the initial design phases outside of this project, patient feedback was incorporated. And as Mona touched upon, we are checking in on this regularly, because we collect a variety of different statistics, including patient feedback in the tool as a matter of normal use.
Thank you. Does Limbic screen for safeguarding concerns?
Yes, so this is something that I can only speak about for our service. From my perspective, for us to go live on this, risk and safeguarding had to be very much included. So there are questions that we've created for our AI robot assistant that are specific to us, and yes, it screens for all of that.
Thank you. So actually, on a similar question, someone's asked, are you concerned about being immediately greeted by an impersonal AI? Will it put off potential patients who are simply seeking human support in an increasingly isolated world?
Well, interestingly, that was one of the big concerns from our clinical leads and from our staff at the beginning. You know, what will happen? Will people want this? And what we've discovered is it's the exact opposite. Our referrals have gone up. People really like completing their referral this way. They feel very, very comfortable with it. But I think I mentioned it in my presentation too. We worked very closely with Ross and the team around how we wanted the tone of the language to be. You know, we were really careful around questions. So it does sound very friendly, very informal. It's very chatty. It's not a sort of robotic yes or no answer tool. It is very, very personalized.
Yeah, that's brilliant.
On this one, again, echo everything Mona says, and indeed the tonality of the voice has been heavily influenced by the team at Insight, and the impact of that is being observed. But we did a thematic analysis on the qualitative feedback that we collect in Limbic Access, and so we're looking at sort of 90,000 patients have responded. So it's a large data set, and we analyzed the key themes. And really, really interestingly, and I agree, counterintuitively perhaps, the fact that Limbic is unashamedly a robot and an AI and not a human is raised as one of the key benefits by the patients themselves. And again, if we sort of speculate, there could be a real activation energy as the first step to accessing care, being having to articulate vulnerable thoughts and feelings over the phone to another human. You know, that can be tough, and this can just sort of like lower that friction in, and indeed that's what we observe in the data as well. So
that's really interesting, because it follows on from a question that says, does the data suggest that the use of the chat box actually increases uptake of those considering to make referrals? Given the choice, would patients prefer a form or a chat box?
Before we answer that, just to say that all those options are available. So patients can telephone us, they can fill out the web form, they can go and see their GP, and we can receive professional referrals. Yep. So all those traditional routes are already open. What we've observed by putting Limbic on the website is that is by far the most popular route. But I'll hand over to anybody else who wants to add to that.
Yeah. Anyone?
No, I think that's clear.
Yeah, I agree with Andy. I think we have seen, I would need to look into the data, but I think we have seen an increased conversion from visitor to referral, which indicates that Limbic is contributing, at least partially, to converting those people who were just having a look to actually, I would like to make a referral in.
Yeah, that data's come through really clearly, and I think that's a huge contributor to the 30% increase in referrals. Those people who might have gone, oh, I'm going to just check it out. You know, the fact that this bot pops up in the corner and is very chatty, I think that's absolutely helping with the conversion.
That's brilliant. Well, we've run out of time for questions, but if you do have any burning questions, I know that Ross is really happy to share his information. But I'd really like to thank Mona and Andy and Ross today for what has been a really interesting webinar, and I'm so grateful for your time, and of course for our brilliant attendees who have been behind their screens listening. Thank you all so much, and of course thank you Limbic for sponsoring what has been a really educational webinar.